Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
So for follow-up, we should do thyroglobulin assessment and imaging. So first, thyroglobulin assessment. Thyroglobulin assessment or measurement. Okay, for the measurement of thyroglobulin, actually thyroglobulin levels after total thyroidectomy for a patient who has undergone total thyroidectomy, for him the thyroglobulin levels should be less than 2 nanogram per ml. And if the patient Okay, this should be less than 2 nanogram per ml if patient is on T4. Okay, or the thyroglobulin levels after thyroidectomy, they can be less than 5 nanogram per ml if the patient is hypothyroid. If the patient is hypothyroid, fine, they can, even if they are less than 5 nanogram per ml, then it is fine. But if the patient is on T4, then the thyroglobulin levels should be less than 2 nanogram per ml. If the thyroglobulin levels, in any case, if it is more than 2 nanogram per ml, it is most of the cases it is suggestive of metastatic disease, or it suggests that there is persistence of normal thyroid tissue is seen. Especially, one more important thing is if TSH levels increase. So if actually thyroglobulin will increase if TSH levels increases. When does TSH level increase is seen? It is seen whenever the patient is hypothyroid. In such cases, the thyroglobulin levels will increase. Thyroglobulin levels will increase due to TSH levels, increase of TSH levels, which can occur due to hypothyroidism. Why can hypothyroidism occurs? Hypothyroidism can occur after radioactive iodine scanning, or it can also occur after thyroidectomy. Okay, total thyroidectomy. So that is the reason why we supplement T4 and then we check for less than 2 nanogram, we check for thyroglobulin level. So thyroglobulin level should be less than 2 nanogram per ml. But if it is more than 2 nanogram per ml, after giving T4 also, then it is metastatic disease or normal thyroid tissue is left. So in 95% of the patients with persistent, 95% of persistent or recurrent, if the in 95% of patients with persistent or recurrent thyroid cancer of especially follicular origin, these will have a thyroglobulin levels of more than 2 nanogram per ml. Okay, now, so for this case we should give, and we should also measure thyroglobulin and anti-thyroglobulin antibody levels should be measured. So thyroglobulin and anti-thyroglobulin antibody levels are measured initially. They are measured initially at 6-month interval. So you will measure the thyroglobulin and thyroglobulin antibody levels are measured initially at 6 months interval, and then you will measure, then later you will measure it annually. Okay, next. Recently, it is found that thyroglobulin measurements, if you do these thyroglobulin measurements in FNAC aspirates, after taking an FNAC aspirates, if you do a thyroglobulin measurement, then this will be useful in, mainly it is useful in detection of nodal metastatic disease. It is very useful in detection of nodal metastatic disease.
thank you and thank you for watching.